Hello and a very warm welcome. You're watching Policy Watch with your host Kriti Mishra. The Health Ministry has approved the Health Data Management Policy of the National Digital Health Mission that intends to digitize the entire healthcare ecosystem of India by creating digital health records and creating and maintaining registries for healthcare professionals and health facilities. The move comes in a bid to ensure a smooth framework for the multiple stakeholders associated with healthcare delivery to individuals in the country. The policy acts as a governance document across the national digital health ecosystem and sets out the minimum standard for data privacy protection that should be followed across the board to ensure compliance with relevant and applicable laws, rules, and regulations. The draft policy was placed in the public domain to seek feedback and suggestions from citizens and stakeholders, and after extensive stakeholder consultations and feedback, the policy was further modified based on inputs received from the public. And for deeper insights, I'm joined by Mr. Abhishek Kumar, Director, National Health Authority, and Dr. Rajiv Dasgupta, Chairperson, Center of Social Medicine and Community Health, JNU. Welcome to Rajya Sabha Television, both of you.
Thank you.
Mr. Kumar, coming to you first. Take us through the important highlights of the Health Data Management Policy.
Health Data Management Policy, it is the basic policy framework for National Digital Health Mission. So as we know, National Digital Health Mission seeks to create an interoperable national digital health ecosystem. What it means? It means that in the health ecosystem, all the stakeholders should be able to operate without any hitch. As on date, the challenge is that various interventions, especially digital interventions in the health ecosystem, are quite fragmented, and we don't have an interoperable ecosystem where patients can avail of health facilities and health services across ecosystem in a seamless manner. So that is the basic objective of National Digital Health Mission. Now, once health mission is launched, it is very important to lay down a policy framework through which sharing and exchange of data will be governed, because we fully understand that health data and personal data of individuals are very important. It is very important to ensure privacy and security of data. So keeping these things into account, Health Data Management Policy has been launched. So security and privacy by design, that is the key principle of Health Data Management Policy. If you ask about basic constituents of Health Data Management Policy, there are some key elements. First key element is that participation in National Digital Health Mission is voluntary. Nobody can be forced to participate in a National Digital Health Mission. Next point, this National Digital Health Mission seeks to create an interoperable layer over the existing health ecosystem. So
Sir, I'm sorry, I'd just like to understand. You said that participation of an individual will be on voluntary basis. Now, those who wish to participate will be issued a unique health ID after verification through a valid government document, including the Aadhaar card. I'd just like to understand what will be the method of obtaining consent notice or for collection of or processing of personal data.
Yeah, so consent is very key aspect of health data management policy, and any data of individual can be collected and processed only with the consent. So as laid down in the policy, consent can be obtained in two ways, either in physical form or electronic format. So when we say consent in electronic format, there are various ways in which consent can be obtained, like by way of OTP authentication, one-time password authentication, or it may be obtained through biometric authentication. It may be obtained through demographic authentication. So there are many ways. It can it can be a direct exchange of consent between individual and our electronic system, or it may be in assisted manner through some hospital or facilities. Like suppose somebody creates a health id can be created either through online portal of health id, or it can be created even at the reception counter of any hospital or clinic.
All right, sir. All right. Let me make that to Dr. Dasgupta. Dr. Dasgupta, we were talking about the portability. How will this policy ensure portability in the provision of health services across the country?
This policy actually has tremendous potential for portability. For example, the banking system has been quite revolutionized as we experience now, with a whole lot of convenience, including security. The challenge in healthcare provisioning is both across tiers, which is primary, secondary, tertiary, as well as across providers, which is public and private. And a lot of what's in the policy and what will finally take shape in the implementation phase will depend on the extent of onboarding of the diversity of these players. However, as far as portability goes, it's at three levels. One is what's called the electronic medical records, which is the records available within a hospital or a system. And then you have the electronic health records, which will be available for one patient across a plethora of providers. And in fact, this policy actually provides for including both the modern medical system as well as the Ayush systems. And therefore, it actually has the potential for offering greater choice. And finally, the personal health records, which is available with an individual. Also, this has significant potential for providing what's called continuum of care, which is in terms of management, which is in terms of information sharing that a patient or his or her caregiver gets from the individuals, and what's called relational continuity, which is a central relational frame when a patient moves across providers. All this is, of course, very complex, but
Yes.
it's exciting too.
Absolutely, it is very complex. And since we'll be dealing personal health data or personal health records, Dr. Das Gupta, I'd like to understand, of course, that this policy will provide adequate guidance to set out a framework for the secure processing of personal and sensitive personal data of individuals. From a privacy perspective, what are your biggest concerns regarding the policy, considering India is yet to enact a data privacy law or data protection bill, which is still being considered by the Parliament of India?
Well, if we go into the policy document of this, it does touch upon this point in considerable detail. It does flag the privacy security imperatives. It does clarify that this will be in conjunction with the other data privacy laws. So it will depend upon the extent to which the data privacy laws are framed, are implemented, and most importantly, as goes with any electronic system, as glitches appear, they are corrected, and those corrections come into force. There is also the provision of how much an individual patient actually will allow his or her data to be shared, because all individual data may not be relevant for all providers. So the short point is that as implementation progresses, some issues and glitches will appear which will need to be fixed, but those aren't the things that can't be fixed. Assuming the data privacy laws are in force, which of course is evolving as we know.
All right, let me take that to Mr. Kumar. Mr. Kumar, as you said that this health data management policy is the first step in realizing the NDHM's guiding principle of security and privacy by design. With the emergence of big data and increase in online data management, concerns around the protection of different kinds of sensitive personal information of individuals are being raised globally. What is the way ahead for India?
Yeah, so in the context of NDHM, we need to fully appreciate few basic points. First point is, through National Digital Health Mission, we are not laying down any entirely different system for treatment or availing of health services. Even now, any citizen or any patient, if he or she has to avail any health services, they definitely share their personal data. So only change being brought about by this National Digital Health Mission is that we are creating an additional digital layer which will ensure interoperability of data and interoperability of services. Next important point is that in National Digital Health Mission, we are not creating any centralized repository of data. In NDHM, we are going by federated architecture in which health data will remain only at the respective facility level. Only the registries of identifiers, they will be maintained at central level, and only very basic details like name, gender, address, they will be stored in centralized database. So we are not creating any centralized repository of data. So
Okay.
the only concern related to privacy, and which becomes relevant from the perspective of implementation of NDHM, is that whatever data is being shared by way of this digital intervention, that should be fully secured. And since we are storing data in respective facility only, no centralized repository is being created, we are taking all the measures possible in NDHM so that data at rest and data in transit are fully secured whenever they are being shared based upon consent of the individuals. So that way, first of all, by the very structure, since NDHM doesn't seek to create any central repository of data, nor does it seek to create an entirely different ecosystem and reinvent the wheel. So that way, basic security of data is already ensured, and whatever data exchange and data sharing will take place, NDHM is
Yes.
very well sensitive to needs of security and privacy of data, both at policy level as well as implementation level.
All right, that will require massive amalgamation of digital solutions. Dr. Das Gupta, how will we leverage the information systems existing in the Indian health sector right now?
Well, we already capture an enormous quantity of data.
Yes.
The challenge, as you said, is how do we manage this legacy? Other countries have, many other countries have gone through this phase, and it's a very painful phase, which is as follows, that the current management information systems are extremely fragmented. Different institutions, public and private, run on different kinds of software, different kinds of architecture, and therefore fitting or rather retrofitting this back into a central architecture is an enormous challenge. And add to the fact that participation of both patients as well as institutions are voluntary. And the fact that a very large a proportion of treatment, patient treatment, is provided by the private sector, as we have seen with various insurance models, particularly the publicly provided insurance models. the participation of the private sector hospitals or institutions are voluntary, and therefore there is a lot of room for unevenness. So while there is a provision and an enabling provision, I may add, for anonymizing data and aggregating data, which are important from the point of view of research, from the point of view of planning, from the point of view of monitoring. These are indeed very important requirements. At the same time, amalgamating current systems into this new architecture is an enormous technological challenge as well as a management challenge.
All right. We also know that government will now work on the guidelines for the implementation of this policy. Mr. Kumar, how will you update the policy from time to time, making it more relevant in the current times?
Yeah, so health data management policy lays down basic framework, and there are certain aspects which will evolve with time. So if we see health data management policy, there are various clauses in the policy which say that as notified by NDHM from time to time, because we fully understand that through National Digital Health Mission, we are trying to create an ecosystem. That is why it is very important to observe how the ecosystem evolves and how various needs arise. So accordingly, various notifications will be made under NDHM. As on date, already various notifications have been published on the website of NDHM. To give one example, the policy says the data can be collected and processed for the purposes as notified from time to time by NDHM. So we have already published one notification in this regard, laying down the purposes. Now, going ahead, we may realize that these set of purposes may need to be modified. Something needs to be added, something needs to be deleted. So accordingly, it will be updated as the project evolves with time.
But the basic question is also about increasing the awareness. Dr. Das Gupta, how do we increase awareness of the importance of data privacy and instill a privacy-oriented mindset, especially among the members of NDHM and its ecosystem partners or stakeholders?
Well, there is indeed a privacy. There are indeed privacy concerns, and as we have seen in the last 1 year with the COVID situation, different countries all made different kinds of electronic disease surveillance mechanisms,
Yes.
including apps. There are countries where the trust in the public system is a lot more than other countries, and that has had a bearing on how much data was shared or given access to, and that did have a bearing on the COVID containment. Here, what's going to happen is, then, in fact, the first steps will be what are known as creating these registries. And these registries are really the building blocks. So there will be a doctor's registry, there will be a patient's registry, a pharmacy registry, dental doctors, Ayush, and so on. So that's really the first step, where you rope in both the providers and the beneficiaries. So the privacy concerns will actually begin at this stage, and therefore, as was explained, the extent to which we are able to keep up with laws, keep up with technology, and most importantly, address the concerns of those who are getting into these registries. The privacy concern is not only on the part of the patient. The privacy concern is on part of providers too, because they are also becoming part of a network and certainly sharing and receiving a whole lot of data. So it is really the extent to which the reaching out and the sensitization happens at the registry formation stage will certainly, I believe, have a bearing on how things progress.
Mr. Kumar, do you agree?
Yeah, see, whenever any new system comes, usually concerns will arise. how this change is going to impact various stakeholders engaged in the system. But as I said, National Digital Health Mission is not like reinventing the entire wheel. Rather, it is on the top of existing healthcare ecosystem. So first of all, NDHM is just for re-engineering of business process whereby any person who was earlier required to carry all the physical records, instead of that, the person will be able to carry medical records on mobile and share it as per their wish on touch screen. That's all. So, as such, I do not see any fundamental reason why there should be so much concern about data privacy issues. But definitely, whenever we create a digital system, since movement of data from one system to another system is involved, and we need to make our worst technological system to take care of data security. So that point, to that extent, point is valid, and we are fully aware of these concerns. Health data management policy is basically a foundational step in the direction of addressing these concerns. And as I said, even at implementation level, we are taking full care.
All right, so Mr. Kumar is allaying all our concerns regarding privacy or regarding security of our data. But before we end this conversation, closing comments from both my guests. Dr. Das Gupta, way ahead for India as far as health data management policy is concerned.
Well, as I said at the beginning, this is indeed very exciting. This is necessary too, as treatment processes become complex, as public health programs become complex. And therefore, it's really crucial that this succeeds. But this will succeed primarily because it's a whole lot of data sharing, both on the part of individuals as well as institutions. This is a system that should put trust as a very central and core value.
Mr. Kumar, closing comments from you.
National Digital Health Mission is a great step in the direction of revolutionizing our health ecosystem, and this mission is going to succeed with cooperation and support of all the stakeholders involved in the ecosystem. Once this mission is fully completed, the people will get immense benefits in terms of ease of availing of healthcare services and all the concerns related to data privacy and data security. NDHM is fully in knowledge of these concerns, and we are taking maximum care. We are paying maximum attention to these aspects, and we will ensure that there are no challenges in ensuring security and privacy of data, the core principle of citizen being in control of data, that is bound to be implemented, and everybody should remain assured about that.
All right, so that's a big assurance coming from you, Mr. Kumar. On that note, thank you so much for joining us, Dr. Das Gupta and Mr. Kumar. So the Health Data Management Policy is a proactive initiative for protecting the health data of our citizens. That's all we have for you in this edition of Policy Watch. Thanks for watching and stay tuned to Rajya Sabha TV.